We want every child who is currently eligible for S-chip to remain eligible. The President has offered to increase the S-chip budget by 20% to accomplish that. He said yesterday, if that isn't enough, then we'll find the money to accomplish it. But then, he says, we need to get down to a very serious conversation about how we assure that every American has health insurance. That's the discussion we ought to be focusing hard on. We ought to reauthorize S-chip and then get on to this bigger conversation. What we know is when we start to expand that almost 1 out of 3, and as you get higher in income, it's 1 out of almost 100% of those who have private insurance will exchange it for government insurance. And so if the incentive is to get people from private insurance to government insurance, then we're moving toward the federal government insuring everyone. And that's not our goal. Our goal is if a person is poor or elderly or disabled, then government has an obligation to offer them insurance and to pay for most of it. But everyone else needs to live in a system where there are options that they can buy insurance they would afford. And if they can't afford it, then we need to help them.